So a lot of people have been asking me what's better, massage or exercise? As far as getting yourself rehabilitated from your injury, let's say this is a soft tissue injury, mild to moderate. What's better? Should you be massaging the area or should you be exercising the area? The truth is you should be doing both, but I'm going to explain which is better in this video. Before we get going, the best thing you can do, better than both those things, is subscribe to Riley Rehab, because then we're going to be making new videos every single week, making you the expert of your own body. And this is a big dilemma. There's some people who say you should go get massages, there's some people who say you should go get all the other. By the way, when I say massage, I also include all the other fancy schmancy laser, ultrasound, machines, whatever, chiropractic adjustments, any of those things that basically involves something kind of being done to you rather than you going and doing exercises yourself. And it's a big dilemma. A lot of people talk about it in my community. Basically, how I see it is for the majority of mild to moderate soft tissue injuries, meaning any kind of tendon, ligament, muscle, what have you, kind of strain, 80% of the benefit you get is going to come from actually doing exercises to build it up and get it stronger. Combined with kind of common sense, making sure you don't overdo things. But 80% is going to come from you doing the exercises, you doing the right thing to get yourself stronger, get yourself back on track. And that essentially, what that means to you guys listening is, if you're much better off, if you are going to go see a physiotherapist or someone, you're much better off figuring out what exercises you need to do and then going home and executing those on your own, because that's actually going to make things better for you. That's going to give you the most bang for your buck, essentially. But on the other hand, the other 20% I'd say does benefit, and absolutely does benefit, from getting massages, from getting all those sexy treatments you see at those rehabilitation places. Those are all good as well. And I would say you shouldn't rely on those all the way, but when I still think about it, 20% is still quite a bit. Although 80% may be the meat and potatoes, the main thing you want to do, I still think that the difference between 80 and 100% is still pretty massive. Like, if you ask any student, the difference of having an 80% on their grades versus 100% on their grades is the difference of them getting like a B- versus an A+. And you ask anyone and they know that's a huge difference. So I still highly recommend a bit of both. I think it's definitely something you should go see. But if you do have to make the choice between one or the other, I would say exercise is going to give you the biggest change. And I think the big reason for that is because it's something you can do on your own time. And you might be limited to how much you can actually see somebody or get somebody to rub on you, to do something to you. And you ultimately want to, as I said, become the expert of your own body, and you want to take care of yourself all the time. So, I'm going to check out here, but big message, make sure you exercise, make sure you see somebody like me as well.